Hey, how are you?
I'm good. So this is the girl with the four names. And I assume all these names are on your birth, or one or two are not there. But we are in the mental health awareness month, which is May. And how are you doing?
Well, I'm okay. Well, addressing the issue of the names, I go by the name Musayenkosi, Thandiwe, Michelle Whitney Vumani, and people commonly call me Miss Vumani or Ma Vumani, and Thandiwe is the one which is not there on my legal documents, but it's my favorite name. And then on the Mental Health Awareness Month, I feel good. I feel great. I'm happy to be here, and it's a very good mental boost. How are you doing yourself?
I'm doing okay. It's a roller coaster. It's life, but right now I'm already feeling excited for what we're going to talk about and what we wanted to just address as young people in within the SRHR. So, Thandiwe, you are a nurse by profession.
Yes.
But before, I know that you were also an advocate for sexual reproductive health and rights for young people, and especially young women, where we were concentrating on the gender equality part. So I just want to know that what has been your journey in progressing this advocacy, and also maybe do you still love advocating for SRHR?
I have always loved that, and no matter what the circumstances, I'll continue loving that. So it started when I was 15 years old, and now I'm 22, going on 23. I vouch for the empowerment of young women and girls, and also considering the fact that they are within the midst of a gap in gender equality, which also then goes on to affect them in terms of accessing SRHR services. So when I was 15, I was a junior member of parliament, and that's when I started learning all these things. And then I went on to be in the junior council under the city of Bulawayo, whereby we get to interact with children, with young women, and also adolescents as a whole, including the male and female population. So we get to start communicating with them. You find out how they are, how they feel, are they able to access this kind of services. So when I got into the healthcare sector, it was even a major boost, because now I'm able to interact with people on that level of healthcare in terms of deciding which kind of health services should we render to the young people, how easy is it, and how can we change that in terms of the point of being a healthcare service provider. So previously I wasn't in healthcare, and I got to understand the issues that young people face, and now I'm in healthcare. I'm then trying to figure out how best can I help those who are not in healthcare to be able to access this kind of services. And I'm still in the game, definitely, and I'm working on improving the ways at which I can be able to disseminate that kind of information to the rest of the population out there, and especially the young women and girls.
Interesting. You're still in the game of but now as a service provider, and
Yes.
as a service provider for young people, are young people coming to get the services? But before you answer that,
Okay.
As also a health practitioner, we wanted to look at the nutritious part of young people. We are hit by a drought now, El Nino induced drought, and probably the food that we were eating is not enough, or it's not healthy enough, because now there's chai E001, or 101, or some people are even going without the nutritious things. So what's your take on that?
Well, it all goes back to the health policies and how far we are going in terms of the SDGs. So I understand that ending poverty and ending hunger is to be SDG 1 and 2. So looking at SDG 2, well, this is a very important global health crisis. And then I feel like maybe the Ministry of Health is trying to work with certain organizations. I, for one, can call maybe the WHO and the World Vision in terms of providing nutrition-sensitive interventions to the population out there. Also, I would like to then go to give an example about the women in the rural areas. I believe they're the ones who provide us with food in terms of what they do, in terms of farming and all that. So we are trying to work with what we have as a country, what we are able to access from the farming activities in the rural areas. So we need to I don't know how best I can say it, but empowering the women in the rural areas in terms of food security and giving them the resources to continue providing food for everyone else in the country. But this is a very difficult thing, so I wouldn't comment much on that. But I'm really hopeful that the government of Zimbabwe is able to facilitate and cater for that particular area in terms of nutrition. It's very difficult, but if we are to look at the basics that we have, we can go somewhere as long as we have access. So the issue here is access. Are there enough resources? Are the people who supply us with that kind of service like food security, are they empowered enough? Do they have those resources that they need? So maybe if we are able to look into that as a concrete basis, then maybe we can go somewhere. That's all I have to say.
There's a concrete basis, and also as an empowerment issue, empowerment tool. You're speaking of a lot of issues where you spoke of SDGs, and you know our podcast speaks to SRHR, but also its interlinkages and intersectionality of any other things that makes us tick. So you would find out that SRHR mental health, SRHR human rights, SRHR nutrition, but also maybe as a service provider, but also I need to find out ukuthi sikuthanda njalo as a service provider ondanga. Are we coming to access services? I see a lot of organizations are doing outreaches and all that.
Yes,
but besides outreaches, as young people, siyabuya, because we are a different demographic group, a special one, some people would like to say, siyabuya into to access HIV and testing, all these services that are regarded by the SRHR. Information in itself, maybe.
Okay, so I started being in healthcare like 3 years ago. And I would like to say that young people, they are really not a homogeneous population. But what I have seen is that they are now empowered enough. They are actually coming to seek healthcare services. And we really commend that, especially this population, Yama 2K. Well, I'm part of it myself, but we've seen them coming. They are eager to learn. And now that these services, they are actually available. So SRHR is a context on its own. I think it has a certain framework where we are saying that, do we have these services? Yes, they are there. Are they accessible? Yes, they are. And are the people actually coming there to get them? Yes, they are. Although, of course, maybe there may be a bit of issues like the fear of stigma, the fear of discrimination. But I believe we are doing so well so far, and they're actually coming to get those services. And I'm happy. I am.
Okay. You're happy. I think we need to also mention that this podcast is brought to you by Lunia Center for Youth. So this is an organization that's working on the healthcare, SRHR, and a whole lot of climate change. But on this particular one, they're focusing on SRHR, the accessibility, maybe also the awareness that we can raise amongst young people. So when we know young people, we also have young people with disabilities. We have the key population. We have young people that stay in the squatter camp. I'm speaking this because our next guest touched on a squatter camp in the Ovele Pandli that we often forget ukuthi we also have young people within that setup. So what would be your advice to healthcare providers ukuthi singafinyelela njani to young people if they can't come to you guys? How can you go to them?
Okay, I think this is the part where our community outreach programs come into play, and we have to organize resources. Actually, we have this thing that we call a community diagnosis, whereby we look at a particular community. We then go on to access what is their major problem and what precipitates it, what are the factors surrounding it. So for those communities which are marginalized, maybe squatter camps like Vumani, if you know the place, Culture Park. So if we are to go there, you would realize there are a lot of issues at play, but then let me pick out nutrition and also access to SRHR. So good nutrition is a very good foundation for human development, and without that, it means that we are also going to have issues trying to address issues like SRHR. So if you are to go there, you need to communicate and maybe interview the people who are there as healthcare providers. We go there, we find out what exactly is the issue. Do they even know about this kind of services? The young people who are there. And then after finding out the problem that they are facing and the possible interventions that would also help them, like we need to have community participation. So if we have those things, we then give feedback to the MOHCC, the Ministry of Health, and then maybe they're able to then pour out resources. You go there as healthcare providers, as nurses, including social workers, doctors. We go to them, we provide them with the information. We need to give them education first. So then when they now know what is SRHR, what is entailed by that, what kind of services can they get, and then we then discuss with them further ukuthi lokho ikungakuthola from us amanesi, lokho ikungakuthola from social workers, and then we give them the chance to choose. And once they choose, we then keep on going back to do evaluation. Are we being successful? If not, we then try to evaluate what were our strengths, what were our weaknesses. We then go on to address those weaknesses. But I believe when we do AMA outreach, we really need to go far and beyond Culture Park and actually go to those people who don't even know that we are there. Yes, I believe
beyond Culture Park.
Yes, definitely.
I also love the fact that you said we need to educate, we need to empower, to have access to the information.
Yes.
But Thandi, there's resistance. And if you read newspapers and maybe statistics, ukuthi the HIV and AIDS infections have risen in the past years. Maybe also in COVID, you know, what would you regard around that? And the age group also, it's very sad that it's also young people that are in the age range, you know, 15 and 24. What could be the problem that we are facing?
I think we have an information gap, definitely. It all goes back to information because, believe you me, if you are to go to people and start giving them services without them knowing actually what it is about, then we have a problem there. So I would pick misinformation as my number one issue, and also maybe the way that we then communicate with them, which is where young nurses come to play. And this is like me.
Yeah.
Because I believe we understand each other at a peer-to-peer level. So if I'm to go there as Vumani, who is just 22 years old, I start talking to you about those kind of issues. You are able to understand me than to have maybe someone who's a bit older, because that person, in as much as they care about you, you may be inclined to think, well, you know, this is my parent, and it may be difficult to communicate about such sensitive issues. So we need to try and make these services available from a youth-friendly point of view. So if you are to have young people and who are going to communicate, give out this information without showing any stigma, any discrimination, be embracing, showing empathy and sympathy, then we are good to go.
Empathy and sympathy, it is. Thank you so much, Vumani, for taking your time out of your busy schedule with the patients where you work. But we appreciate you as a young nurse. We appreciate you also as an advocate for SRHR. Above everything, we appreciate that you are a gender equality advocate. So thank you so much for coming, and I hope that you enjoy the rest of your day, your week, and be happy.
So much.
That's right. Thank you so much, Vumani.
Like, I'm also happy to be here. I'm happy to be a young nurse. Being a young nurse means that I'm able to get into people's lives and impart knowledge and skills that are going to help them be better in terms of their health. So yeah, I look forward to doing more of this.
Thank you so much. Thank you.